Now, Christians and Muslims across Nigeria and Africa are being asked to fight the coronavirus by stopping going to church and mosque and to worship at home instead. Many countries have banned all religious gatherings, but some worshippers and churches and mosques in Nigeria and other parts of the continent have flouted local bans on meetings of more than 50 people. Well, now President Buhari has imposed strict measures in Abuja, Lagos and Ogun state, limiting the movement of people beyond their homes. Mr. Buhari announced some exemptions to the ban, but it does not appear to include churches and mosques.
It does not apply to hospitals and all related medical establishments, as well as organizations in healthcare related manufacturing and distribution. Furthermore, commercial establishments such as A, food processing, distribution and retail companies, B, petroleum distribution and retail entities, C, power generation, transmission and distribution companies, and D, private security companies are also exempted. Although these establishments are exempted, access will be restricted and monitored. Workers in telecommunication companies, broadcasters, print and electronic media staff who can prove they are unable to work from home are also exempted.
Well, for his reaction to the lockdown and its implications for the faithful and the less well-off in Nigeria, I'm joined now in the studio by the theologian, human rights activist, social commentator, and one of the most gripping clinical analysts of the Nigerian condition today, Fr George Ehusani, chaplain of the Lux Terror Leadership Foundation. Thank you ever so much for coming.
Thank you, Charles.
And for bearing with us.
Thank you.
First of all, before we talk about your reaction to the lockdown, how prepared are you for it?
I wonder if anyone was really prepared for this. We are living through unusual times, and having gotten here, we need to put all our efforts together, collaborate to make sure we defeat this enemy, this common enemy. And so we have all been part of the campaign, people to stay at home, to keep the social distance, to wash their hands as many times as possible in the day, and to watch out for people who have recently arrived from some journey, and if those people are not isolating themselves, to encourage them to do so. And that takes me to the whole issue of churches and mosques. Like I said, these are unusual times, and so unusual measures have come to play. Before the government's own instruction about churches, Christian Association of Nigeria has met. Then in the Catholic Church, the bishops of the various dioceses have issued statements suspending the congregational worship. As you know, we priests, we say Mass every day. So the priests will say Mass for their people, but without the congregation being there. And for us, two people, 3 people at Mass, is as powerful as 1,000 people. So we offer the sacrifice of the Mass nevertheless. And so last Sunday, for example, many priests offered Masses in their churches and streamed it online for the benefit of their people. I did the same in Lux Terra, and it was on TV. And we were, you know, an empty church with a handful of people. The times call for that, and I don't think that any responsible clergyman, at least Christian clergyman, seriously objects to that now. Right. I'm told that there were a few places, it was actually not last Sunday, not yesterday, but it is the previous Sunday when the message had not gone round, and when maybe many pastors had not seen the seriousness of the matter. But in the last 1 week, what we are seeing all over the world, I think the overwhelming majority of pastors and imams are able to see that there is a reason for this. And those who are getting infected are those who have come in contact with people who have the virus.
In other words, it makes absolute sense, what the government is doing.
It makes sense.
It's interesting that President Buhari listed a number of exemptions from the lockdown, but religious establishments or religious, clergy like you were not included. I mean, what's your reaction to that? Do you think he doesn't consider you to be an essential service?
We are an essential service in our own way, in the sense that just as we take all the medical precautions and resort to all the medical approaches to get a cure, well, spiritual people also consider that prayer and worship and offering of sacrifices under this kind of circumstances is very, very necessary. However, what we agree with the government is that I don't need my 1,000 people gathered in order to do that. And so I run a TV program, and I'll still run my TV program, Mass, but not with the congregation.
Right.
So
your advice, or perhaps I should say your godly advice to your worshippers at this time is for them to worship from home.
Worship from home, it is. We actually told them that this is a time to deepen their domestic devotion, their devotion as families in their homes, coming together, observing social distance, by the way, but coming together as families to worship God in their homes. This is a time to deepen that kind. Last Friday, Pope Francis had a major worship session at St. Peter's with an empty church, but all of us were hooked to it via television. So to show that we don't stop praying.
Right.
We are not stopping in our engagement of prayer, but because of the seriousness of the situation now, we suspend congregational worship.
But the advice is unequivocally against coming together for gatherings, and that's the official advice.
Yes, of course. Like I said, I run a television program, so I run a media outfit. So, and every Sunday people are watching at home, seeing, but then the group that used to gather will no longer be able to gather for it. But like I said, every priest says Mass in the church. Every priest, every day we say Mass. We don't need congregation to say Mass. Every priest says Mass.
But what I'm asking is that it's a complete blanket ban.
No, we can't be stopped
or
from
are you
saying
saying,
Mass.
Let's
Wait a minute.
have 6 feet between people? And
no, the priest doesn't need people to say Mass, and most priests live where the church is. We don't need the people. We don't need crowd to say Mass.
Right.
So what I'm saying is that we don't stop praying. We can't stop praying. And the priest often lives in the same compound as the church is. So we'll go to church, we'll say Mass.
Right.
Now, but the people are told, don't come. But we are praying for you.
Sure.
And as the priest says the Mass, he streams it online and the people follow.
Okay.
So,
Father, stay with us. We want to talk to you some more. You're watching the Arise interview. Plenty more still ahead as we continue our chat about the lockdown imposed on parts of Nigeria and how it's likely to affect the faithful and the less well-off. Stay with us. Welcome back to the Arise interview. I'm Charles Enyekudu. With many countries in Africa now banning religious gatherings in order to slow the spread of coronavirus, Christian worshippers are turning to online or televised services on Sunday. The continent has some of the world's most committed Christians, according to a 2018 survey, and the inability to go to regular church services has been hard for some of the faithful. While the online streaming of services is not new, Sunday was the first time that many preachers had been talking to empty pews. They also referred to coronavirus in their sermons. In Nigeria, the clergy had a similar message, with some telling their congregations that faith can conquer the fear of coronavirus. We'll talk some more to the Catholic priest and respected anti-poverty activist, Fr George Ehusani. But first, here's some more of President Buhari's speech on Sunday, in which he outlined some of the measures being taken by the government to ease the effects of the lockdown on the poor.
For residents of satellite and commuter towns and communities around Lagos and Abuja, whose livelihoods will surely be affected by some of these restrictive measures, we shall deploy relief materials to ease their pains in the coming weeks. Furthermore, although schools are closed, I have instructed the Ministry of Humanitarian Affairs, Disaster Management, and Social Development to work with state governments in developing a strategy on how to sustain the school feeding program during this period without compromising our social distancing policies. The minister will be contacting the affected states and agree on detailed next steps. Furthermore, I have directed that a 3-month repayment moratorium for all trader money, market money, and farmer money loans be implemented with immediate effect.
President Buhari, and with me in the studio, the human rights activist and anti-poverty campaigner, Fr George Ehusani, chaplain of the Lux Terror Leadership Foundation. Thank you for staying with us. And you're a big anti-poverty campaigner. What's your assessment of what the president said in terms of what he was offering to try and help make this lockdown easier on the poor and the less well off?
I believe many Nigerians would say very nice words, but implementation, the logistics. One is that we have a problem with data. How many people live around the slums of Abuja? Those settlements in the satellite towns and the slums, the unregistered villages around Abuja. We don't know. So how do you plan for what you cannot count, what you cannot measure? What you cannot measure, you cannot plan for. So we are caught pants down now because we never had proper data.
Which could have been done when there wasn't a crisis.
Years before. So it's a real challenge. Nice words from the president, but how do you implement? The poor people, if by midnight today they can no longer move, in 3 days there will be crisis. There will be crisis because they will be hungry. The majority, maybe 10, 15, 20 million Nigerians depend on going out each day before they can feed the next day. So if it doesn't happen 2, 3, 4 days, there will be crisis. So some people think that we got some period of grace. This problem started in China on the 10th of December. So we had 3 months of grace to prepare for this. And we were not ready. We're not ready. And all I would appeal to people now, to Nigerians, is Nigerians of various faiths and persuasions should reach out to their neighbor. Should reach out to those of us who are privileged to be sure of what we will eat today, tomorrow, next tomorrow, to reach out to people who cannot be sure of what they will eat the next day or even that very day. Each one of us, we have some mechanics, some cleaners, some domestic workers, some people who are now going to be locked at home. We should find a way of reaching them with some food item, with some clean, with drinkable water, with some help. The message that has been coming from the Holy Father, Pope Francis, all this while is about tragedies like this can bring out the worst from human beings, but they can also elicit the best from human beings. So kindness, generosity, compassion. This is the time to bring out the best of the Nigerian spirit of compassion and brotherliness and so on. Solidarity. This is the time to show how good we are by reaching out to people, because, like I said, we would expect the best from government, but we will be realistic, knowing what the failures are and what the handicaps are. And I unfortunately do not expect that so much will be achieved in the next few days for the poorest of the poor, who will be left stranded, completely stranded.
Well, let me just let you know that we're hearing that Ogun State, the government of Ogun State, has postponed its lockdown till midnight on Friday. Is that the sort of thing that you think the federal government should have done, to say, instead of saying, I mean, the speech was delivered on Sunday, the lockdown takes effect on Monday, give them people a few more days to be able to sort of gather their resources and stuff?
Partially, but like I said, the poorest of the poor, which will be
it doesn't make any difference.
It doesn't make any difference, because unless they go out to roast their corn, unless they go out to roast their plantain or to do their vulcanizing, they cannot eat the next day. So even if you give them 5 days, well, they will earn money for those 5 days. But then the next 5 days, they won't be prepared for it.
But beyond the privations that will result from this lockdown,
Yes.
including things like food, which is
Yes.
obviously very important. Do you think poverty could hinder prevention of the disease, which
To
is
some
essentially
extent.
what they're trying to achieve? I mean, would it be difficult to enforce prevention measures in Nigeria in some places because people are too poor to cope with those measures?
An Indian doctor just sent out, I read something on social media, and
Right.
he says the various preventive measures for COVID-19 are prerogatives of the comfortable. He says, for example, social distancing, 2 meters apart, where people live 5, 6, 7 in a room, where you don't even have 2 meters between one house and the other. So social distancing is the prerogative of the rich and comfortable. Then wash your hands with running water is a prerogative of the comfortable, because where do the poor people in the slums have running water? And so on. So all this, it is a pity that Nigeria has no business being one of the poorest countries in the world, but we are. And what this has done, which is why it is so important for religious people to keep praying, because we don't have the logistics, we don't have the equipment, we don't have all what we need to deal with a major pandemic. Because imagine this disease getting into the slums and infecting people in the IDP camps, for example.
Well, that was going to be my next question to you, because
It is frightening.
The point really is that the country is unprepared
Absolutely.
for it, and beyond the fact of the preventive measures, which is why they're very keen to prevent it, the cure, the treatment procedures are simply not in place either.
One of the measures that could be taken in the interim, like if they had a few days, like Ogun has a few days, maybe churches and mosques can put together some quick makeshift bathrooms and buy mattresses, that churches and mosques that can afford it, to settle people who live in very absolutely decrepit conditions, to move into more spacious areas where they can have conveniences. I mean, you have places where 10 people are sharing one bathroom, one terrible bathroom. How do you observe social distancing there? How do you observe basic hygienic conditions there? So when I talk about reaching out, especially reaching out to the poor, perhaps one thing that religious people can do is quickly see how we can open up schools,
right?
Mission schools.
But how much is this a test for the religious in these circumstances? Because I mean, a lot of priests, a lot of bishops and all that, they with sort of the nice sort of expensive gowns and all of that. I mean, they all live in very comfortable homes.
Well, you're talking about people in cities. We still have hundreds and thousands of priests, at least Catholic priests, that live in villages.
Yeah, but you also have a lot of people who live in slums around Abuja.
Yeah,
and a lot of people.
The point is that there are a number of priests around Abuja who live with their people in those poor conditions. What often happens today is that when people are talking of priests and pastors, they are just looking at mega churches and their pastors.
No, I'm not talking about the mega churches,
But
I'm talking about the Catholic church.
I am saying go to the Catholic church in Ogun, go to the Catholic church in Paduma, go to the Catholic church in Deide, go to the Catholic church. The point is, the Catholic church is, we have over 100 Catholic churches around Abuja, outside the city of Abuja. And those priests who live in those places, they live at the level of their people and are actually daily sourcing for resources to help their people, help them get to hospital, help them take care of their child that is sick. They are doing the same kind of thing that that priests, Holy Ghost priests did in those days in the East, when they were helping their people get to hospital, helping their people get to school, and so on and so forth. We still have the majority of our priests doing that today in the various parts of this country. And I'm saying they can extend that. Within this period, they can extend that and actually turn the spaces where possible, the spaces in the churches, the spaces in the mosques, to house people who would otherwise be sleeping on top of themselves because of the kind of accommodations that we have, so that there can be some space. Right now, we are, like I said, we are living through unusual times. Unusual measures need to be taken. When there is some violence or crisis or herdsmen, whatever, churches become the place of refuge. So when there's an epidemic, the churches can also be. And the history of the world has shown that religious houses and churches have become places of refuge when there is crisis like
Very
this.
briefly, because we have to take a break, but we'll come back and continue talking. Do you think this could lead to higher crime?
I pray not.
In other words,
if
when people can't find anything to eat,
when
simply
people
go and
cannot
attack
find
their
anything
neighbors.
to eat, then there is the fear. It is rather frightening. Like I said, if this lockdown goes for 1 week and they do not get the help promised by government, now the head of state, president, has announced that there will be help for the poor. They will be expecting. Human beings will not just sit down and die. They will make some effort to keep alive. Let us pray that the committee going to be put together, those working on money, reaching the poorest of the poor, that they can work hard and the grace of God can support them to reach the poorest of the poor.
Okay, we'll come back to you in a minute. You're watching the Arise interview. Plenty more still ahead as we continue our assessment of the implications of the lockdown in Nigeria with Fr George Ehusani. Stay with us. Welcome back to the Arise interview. I'm Charles Aniagolu. There are currently nearly 5,000 confirmed cases of coronavirus across Africa. South Africa is the worst affected country and is currently in the throes of a 21-day lockdown. Here in Nigeria, some 30 million inhabitants of Abuja, Lagos and Ogun State enter a 2-week lockdown from Monday evening, although we've just heard that Ogun State is putting off its lockdown until Friday. But experts are warning that the lockdowns could prove difficult, if not impossible, to enforce in cities where millions live in poverty and rely on daily earnings to survive. The government has promised cash payments and the delivery of food materials to the poorest in the country, but it's not clear when the payments will be made and relief materials will arrive. More people in Nigeria could be entering the lockdown if the situation worsens. The World Health Organization has warned of the dramatic evolution of COVID-19 in African countries, and the number of cases are continuing to rise. With me in the studio, the theologian, human rights activist, social commentator, and one of the most gripping clinical analysts of the Nigerian condition today, Fr George Ehusani, who's chaplain of the Lux Terra Leadership Foundation. Thank you very much indeed for staying with us. And in terms of what the church normally does, charity-wise, in these circumstances, are you doing anything in terms of medical care and testing, looking at and after coronavirus patients?
As you know, coronavirus is a novel one, and I don't think any of our clinics is equipped, prepared for this.
But you could equip it. I mean, that's what a lot of private places are doing.
They could equip them. But as you know, a lot of borders are closed now, and but there are a few such church hospitals that are third level, and I believe they are in touch with the Ministry of Health and the Center for Disease Control so that they will play their part, particularly identifying people who may be carriers of the virus and quickly referring to, meaning initial diagnosis, so many
testing kits, for example. You could simply test people or have the capacity to do that.
But right now, unfortunately, in this country, there are only a few places, as we are told, that have the capacity to test, which is perhaps one of the biggest weaknesses of our system now, because how do we know that there is only 1 or 2 people doing this and that when
that's a good point.
When they do not have the capacity to test.
That's a major concern.
Yeah, when they don't have the capacity to test. That is why we religious people, we have a lot of hope that God will prevent this disease in descending.
See how, on a practical level, we'll get to God in a minute, but I mean, on a practical level, I mean, you can see how overwhelmed the Nigerian system is, for whatever reason, whether they're to blame for having not done it or whatever. We're in the middle of a crisis and they're overwhelmed. And in those circumstances, the big charity organizations like the church have always come into play. If you go to the UK now, they're doing the same thing. If you go to America, all those places. I'm wondering what the church is doing in Nigeria.
Caritas Nigeria is already mobilizing a lot of help and support to reach out to people. Caritas Nigeria. And you know, Caritas Nigeria has offices in every diocese in Nigeria. 52 dioceses Caritas Nigeria has. Then the St. Vincent de Paul in most of our churches are preparing to do what they can within the limited circumstances to help people who will be diagnosed, people who will be sick, and so on and so forth. And I am aware that in a number of our hospitals, they are already having isolation centers, preparing isolation centers where people will go, and this time you won't ask people for money before.
Yes.
This is an emergency.
Because, I mean, this is where the church could help. I mean, they have accommodation in some places. They have hostels. They have things like that where they could convert those into isolation
like I said
units.
earlier, schools, church halls.
Yes,
I mentioned church halls and schools could be converted. I mean, we have had in Europe, when we have had epidemics in Europe, even church buildings themselves became places for recuperation, places for refuge under this kind of circumstances. We just pray it doesn't get there, but if it gets there, our people have large hearts, and I expect that when it gets to this, we are all in it together. Every one of us is a potential COVID-19 carrier. Therefore, we do what we can to prevent others getting it and to mobilize support for anyone who gets it.
Right. Now, let me just take up a point that you mentioned earlier. You talked about the fact that Nigeria had all these problems, and this is one of the reasons why you're praying and you're calling for prayers and so on. I mean, there are people who've expressed the belief that if they contract the virus, their faith will heal them. What do you say to those people?
Well, I can't fault somebody who believes that his faith will heal them, but nevertheless, I believe it is God that gave us science. It is God that gave us the knowledge of science. Therefore, while praying, part of our prayer in many of our churches is that God should help our scientists eventually come by a cure. So it's not mutually exclusive. It's not one or the other. It is that God is the one who gave us the gift of scientific knowledge, technological knowledge. Therefore, we pray for God to intervene directly, but also God can intervene through human agents like science. So it is a gift of God. The modern medicine is a gift of God. That's the way we look at it.
So in other words,
it is not either prayer or science.
No, I understand that. So you're expected by the church to do what is humanly possible to
avoid contracting or infecting anyone.
Do you think this is where some people have misconceptions about the limits of the power of religion and faith versus medical science? Because a lot of people believe that all they have to do is pray, and there'll be some magical occurrence where they're suddenly miraculously healed.
There are several ways of knowing. The scientific way of knowing is a way of knowing, and it is from God. The spiritual way of knowing is another way of knowing. They are not mutually exclusive. Now, blessed are we if we know how to traverse, how to navigate the two together.
No, but if somebody was sick and came to you and said, I have the faith and I'm going to pray to be healed, what would you say to them?
I will join the person in praying. I will pray for the person, but I will say, please go to the hospital and get yourself tested and submit yourself to the regime of treatment. Because I believe that whatever treatment that we come by is a gift of God, the same God that